Hi, I'm Jose, and welcome to the Data Hunter, where we find data that is useful and reliable.
Today, we will be talking about where to get demographics data on COVID-19 cases from the Philippine Department of Health. According to the World Health Organization, COVID-19 is often more severe in people aged 60 or older. Now, we will explore where to find demographics data from the Department of Health that can be used to test this theory by the WHO.
Alright, so let's get to it. You may click the link in the description below, or you can type in the URL www.doh.gov.ph/COVID-19 tracker, and that should bring us to this page. There is a lot of useful information here as discussed in a previous video, but for now, we will focus on our goal, which is to look for the demographics data. So we click on the little arrow in the yellow box right here. This brings us to a sort of supplementary page to the main COVID-19 tracker. We can see the case curves of the most problematic regions, led by NCR and Calabarzon. And kudos to Central Visayas, where the curve seems to have flattened already. If we scroll further down, we see the cases by demographic figures right here. We see three sets: cases, recoveries, and deaths, subdivided into different age groups with 5-year increments. We notice that the shapes of the cases and recoveries are roughly identical, which we may interpret that most cases often end in recoveries across the age spectrum. However, if we look at the deaths column, we see that the trend skews from that of the cases and recoveries, and more weight is concentrated here on the older end of the spectrum. This means that as far as the Philippines is concerned, the elderly make up a greater share of COVID-19 deaths compared to that of the younger ages. This shows that the WHO's warning that we flashed earlier holds fairly true in the Philippines, that COVID-19 is more likely to have a severe impact on the elderly. And there you have it, COVID-19 demographics from the Philippine Department of Health. Thank you and happy data hunting.